You assume the hospital down the street will always be there. You trust the system. But across America, emergency rooms are going dark. Entire cities are losing their only lifeline. Ambulances now drive an hour past empty buildings, where doctors once saved lives. Today, we are exposing 10 U.S. cities where hospitals are closing and healthcare is collapsing, and why your life could depend on knowing this before you make your next major decision. Coming in at number 10, we have Philadelphia. The city of brotherly love promised world-class medicine. Walk through certain neighborhoods, and you will find some of the finest teaching hospitals in America. The University of Pennsylvania Health System, Jefferson Health. Names that carry weight in medical circles worldwide. But step into the underserved communities just a few miles away. The picture changes dramatically. Hospitals are vanishing, and the residents who depended on them are being left behind with nowhere to turn. Hahnemann University Hospital was a 500-bed facility serving low-income patients for over 150 years. Then, in 2019, it closed its doors forever. A private equity firm had purchased the hospital years earlier. They loaded it with debt. They extracted value. When the building became worth more than the business, they shut it down and sold the real estate. Over 2,500 healthcare workers lost their jobs overnight. More than 30,000 patients were suddenly scrambling to find care somewhere else. The ripple effects were immediate and devastating. Emergency rooms in surrounding hospitals became dangerously overcrowded almost immediately. Temple University Hospital saw its emergency volume spike by nearly 15%. Wait times stretched past 6 hours. Some patients sat for 8 hours before seeing a doctor. Ambulances began diverting to facilities 20 or 30 minutes further away. For a patient having a heart attack, those extra minutes can mean the difference between life and death. For someone suffering a stroke, delayed care means permanent brain damage. The closure was not just an inconvenience. It was a death sentence for some. The closure left a gaping hole in mental health services across the region. Hahnemann operated one of the largest psychiatric emergency departments in Philadelphia. Now those patients flood into general emergency rooms that lack specialized psychiatric training. Staff are overwhelmed by cases they were never prepared to handle. Resources are stretched thin across every department. The safety net is unraveling thread by thread, while politicians make speeches about healthcare access. Property values near the shuttered hospital have dropped noticeably. Businesses that relied on hospital traffic are closing their doors. The economic damage compounds the healthcare crisis in a vicious cycle. Philadelphia still markets itself as a healthcare destination. The marketing materials do not mention the neighborhoods where care has simply disappeared. For retirees who relocated here expecting reliable access to world-class medicine, the consequences are becoming life-threatening. The city that promised care is breaking that promise one neighborhood at a time. And the betrayal cuts deep for those who trusted the system. At number 9, Memphis reveals a disturbing pattern spreading across the American South. Tennessee promotes low taxes and affordable living on every tourism website. Billboards across the state advertise the cost savings of relocating from expensive coastal cities. What they do not advertise is a rural hospital crisis that is bleeding into urban centers with devastating consequences. Memphis sits at the epicenter of this quiet emergency. Over the past decade, more than a dozen hospital facilities in surrounding counties have shuttered permanently. Small towns that once had their own emergency rooms now have nothing but empty buildings. Communities like Covington and Brownsville watched their local hospitals close. Those patients now flood into Memphis. The regional medical center handles the overflow from a 150-mile radius. It is the only Level 1 trauma center serving a population of over 2 million people, and it is drowning under the weight of demand it was never designed to handle. Ambulance diversions have become routine in Memphis. When the regional medical center cannot accept more patients, ambulances reroute to other facilities across the city. Those facilities then become overwhelmed within hours. The cascade effect means patients wait longer everywhere in the metropolitan area. A heart attack victim might ride past 3 hospitals before finding one that can accept them. Staff burnout has reached epidemic proportions that threaten the entire system. Nurses are leaving for travel contracts that pay 3 times their current salary in other states. Doctors are reducing their patient loads or retiring early to escape the pressure. Tennessee refused to expand Medicaid for years, despite federal funding that would have covered 90% of the cost. That political decision starved rural hospitals of funding they desperately needed to stay operational. When those rural hospitals closed, the consequences rippled into Memphis. Uncompensated care costs climb higher each year, as uninsured patients seek treatment in emergency rooms because they have no other option. Hospital budgets strain under the weight of providing care they cannot bill for. The people who moved here for the low cost of living are discovering a hidden price tag that nobody mentioned. The maternal mortality rate in the Memphis region exceeds national averages by nearly 40%. Women giving birth face fewer options and longer drives to reach qualified care. Pediatric specialists are increasingly scarce, as trained physicians leave for better-funded systems elsewhere. The healthcare infrastructure that seemed adequate, on paper, is buckling under real-world pressure that grows worse each year. Memphis looks prosperous on the surface, with its new developments and growing economy. Beneath that surface, the cracks are spreading into every neighborhood. For anyone considering this city for retirement, the math includes much more than just tax savings. Now, at number 8, Youngstown tells a story of American decline that should alarm every citizen. This city was once a steel powerhouse that helped build modern America. Workers earned good union wages. Families built multi-generational lives in tight-knit neighborhoods. The steel mills closed decades ago, sending the local economy into a tailspin. But the decline did not stop with manufacturing. Now the hospitals are following the factories out of town. Northside Regional Medical Center closed its doors in 2018. 468 employees lost their jobs in a single day. An entire community lost its access to local emergency care that had served residents for generations. The nearest trauma center is now over 30 minutes away, by ambulance driving at full speed. For someone suffering a stroke, those 30 minutes can mean permanent brain damage. For a heart attack victim, it can mean death. The closure turned a treatable emergency into a fatal one for dozens of residents who will never be counted in any official statistic. The closure happened despite heroic community efforts to save the hospital from shutting down. Residents organized fundraising campaigns and community meetings. They pleaded with state officials for emergency assistance. They explored every possible option, including converting the facility to a smaller emergency-only operation. None of it mattered in the end. The financial losses were too severe to overcome. The patient population was too poor to generate adequate revenue. Insurance reimbursements were too low to cover operating costs. Youngstown watched another institution abandon it just like the steel mills had done before. Home values in surrounding neighborhoods have dropped significantly as healthcare deserts expand their boundaries. Real estate data shows declines of 15 to 20% in areas closest to the closed hospital. Potential buyers look at the data and choose to purchase elsewhere. Who wants to raise a family or retire in a city where the nearest emergency room requires a 30-minute drive under optimal conditions? The population continues to shrink as those who can afford to leave do exactly that. Fewer people means less tax revenue for city services. Less revenue means fewer services, including emergency response. The death spiral accelerates with each passing year. Youngstown was promised a comeback for decades by politicians seeking votes. Speeches about revitalization echoed through City Hall. Economic development grants came and went without reversing the trajectory. Casino projects and other schemes produced temporary headlines, but no permanent solutions. Now the city serves as a warning beacon for the rest of America. This is what happens when industry leaves and healthcare follows close behind. For families with aging parents still living in Youngstown, the question is not whether they will face a medical crisis. It is whether help will arrive in time when that crisis inevitably comes. Coming in at number 7, Atlanta hides a disturbing truth behind its gleaming skyline and booming economy. Georgia's flagship city projects an image of unstoppable prosperity. Fortune 500 corporate headquarters line the downtown streets. Hartsfield-Jackson Airport is one of the busiest in the world, moving over 90 million passengers annually. Television and film production have made the city a media powerhouse. But the healthcare infrastructure tells a completely different story that the Chamber of Commerce would prefer you never hear. Atlanta Medical Center closed permanently in 2022 after operating for over 100 years as a community institution. It was a safety net hospital, serving the communities that needed care the most, but had the least ability to pay for it. Over 2,000 healthcare workers lost their jobs when the doors closed for the final time. The south side of Atlanta now has fewer hospital beds per capita than many developing nations. The irony is bitter, and the consequences are deadly. Politicians celebrated economic growth with ribbon cuttings and press releases while the healthcare infrastructure crumbled beneath their feet. New stadiums went up with billions in public subsidies. Luxury apartment towers multiplied across the skyline. The hospital that served the poor quietly disappeared without a fraction of the attention given to sports facilities. The closure left a gap that cannot be filled by urgent care clinics and strip malls. Emergency services require trained specialists and expensive equipment that minute clinics simply do not possess. The remaining hospitals in the Atlanta region now handle patients who once went to Atlanta Medical Center for their care. Grady Memorial Hospital has seen its emergency department volume increase by over 20% since the closure. Emergency departments across the city are backed up with wait times climbing past 4 hours on routine days. Ambulance diversions are increasing as hospitals reach capacity. The strain shows in staff exhaustion and declining patient outcomes. People who could have been saved are dying because care is not available when they need it most urgently. Georgia continues to resist Medicaid expansion despite losing billions in federal funding that could shore up struggling hospitals. The financial pressure on remaining safety net hospitals intensifies each year as uncompensated care costs mount. Healthcare analysts predict more closures are coming in the next 5 years. The hospitals still operating are running on thin margins and thinner hope. If you are considering Atlanta for retirement, ask yourself a hard question. What happens when the emergency room you need no longer exists because it was not profitable enough to survive? The answer might determine whether retirement in Georgia is a dream or a dangerous gamble with your life. If this helps you understand what is really happening to American healthcare, hit subscribe. It is free, and it means you will never miss these critical breakdowns that could affect your family. Most people have no idea how bad this is getting across the country. But the next city might be the one you are planning to retire in, or the one where your parents already live. At number 6, St. Louis shows how healthcare collapse builds over generations until the system simply cannot function. The gateway to the West is also becoming a gateway to healthcare failure. The story here stretches back decades, and the consequences compound with each passing year. What started as a single closure has become a pattern of systemic breakdown. Homer G. Phillips Hospital once served 90% of Black patients in the entire region during an era of segregation. It was a pillar of the African American community, providing not just medical care, but dignity and hope. It served as a training ground for Black physicians when other medical institutions locked them out through racist policies. Then it closed in 1979. City officials promised to replace it with equivalent services in the community. That promise was never kept, despite decades of advocacy. The wound in the community never healed, and the healthcare gap has only widened since. Today, the remaining hospitals in St. Louis struggle with chronic budget shortfalls and severe staffing crises. Barnes Jewish Hospital and SSM Health facilities carry an enormous burden of uncompensated care. Rural Missouri clinics that once stabilized patients before sending them to the city are shuttering at an alarming rate. Each rural closure adds more pressure to urban facilities already stretched past their designed capacity. The healthcare system was built for a different population distribution and different financial model. Now it serves far more people with far fewer resources, and the math simply does not work. Emergency psychiatric beds are nearly non-existent across the St. Louis metropolitan area, creating a shadow crisis. People experiencing mental health emergencies end up in jail cells instead of treatment facilities because there is nowhere else to put them. The criminalization of mental illness has accelerated as hospital capacity has declined. Emergency rooms that remain open handle psychiatric crises alongside heart attacks and car accident victims. Staff trained for physical emergencies are handed mental health cases they were never prepared to manage. The results are predictable and often tragic for patients who deserve better. The Gateway Arch still stands as a symbol of American ambition and westward expansion, but the safety net beneath it has massive holes that grow larger each year. Patients fall through those holes and disappear from public attention. Families watch loved ones deteriorate while waiting for care that never comes or comes too late to help. St. Louis is not just losing hospitals one by one. It is losing the fundamental promise that help will be there when citizens need it most. For anyone relying on Missouri's healthcare system, the gateway leads somewhere much darker than the tourism brochures suggest. Number 5 brings us to Texarkana, where the promises of Texas prosperity ring completely hollow for thousands of residents. The Lone Star State boasts constantly about freedom and opportunity. Politicians compete to see who can cut taxes and regulations the most. In border towns like Texarkana, hospitals are disappearing one by one, and residents are paying the price with their health and sometimes their lives. Christus, St. Michael Health System has faced repeated financial struggles that threaten its long-term viability. The hospital has cut services and reduced staff multiple times in recent years. The surrounding rural facilities that once provided first-line care have already closed their doors permanently. Patients in the Texarkana region now drive over an hour each way, just for routine specialist appointments. Simple procedures that should happen close to home require half-day journeys. Some patients simply stop seeking the care they need. They cannot afford the time off work without paid leave. They cannot afford the gasoline at current prices. They suffer in silence and hope the problem resolves itself. Maternal mortality rates in the Texarkana region exceed national averages by a disturbing margin that should shock every citizen. Women giving birth face fewer options and higher risks with each passing year. Some pregnant women drive 90 minutes or more to deliver their babies in facilities with adequate obstetric care. Others take their chances at understaffed local facilities that lack specialized equipment for high-risk deliveries. The stories of preventable deaths pile up in local newspapers. Each one represents a family shattered by a healthcare system that failed when it mattered most. Texas rejected Medicaid expansion to score political points with ideological voters. The decision saved state money on paper and allowed politicians to claim fiscal responsibility. In reality, it shifted massive costs to hospitals that could not absorb them. Rural facilities closed when the uncompensated care burden became too heavy. Urban hospitals in cities like Texarkana strained under increased demand from patients who had nowhere else to go. The patients caught in between these political calculations pay the real price. That price is measured in lives lost and suffering prolonged, not in budget documents. Texarkana sits directly on the border between Texas and Arkansas. Residents joke that they can stand in 2 states at once, just by crossing the street. What is not funny is that quality, affordable healthcare exists in neither state for working-class families. The Lone Star State promised prosperity and opportunity for all. For residents of Texarkana and similar communities, that prosperity does not include reliable access to a doctor when they need one most. The freedom Texas advertises so loudly does not extend to freedom from preventable suffering and premature death. Is it strange how these cities brag about growth and opportunity while their hospitals keep shutting down? What do you think they are hiding from new residents and retirees? Drop your thoughts in the comments below. Do not leave yet. Number 1 is the city everyone assumes is safe and protected, and they could not be more wrong about what is coming. At number 4, Birmingham sits at the center of a rural hospital graveyard that extends across the entire state. Alabama's largest city absorbs the devastating fallout from over a dozen hospital closures that have occurred across the state in just the past decade alone. The burden on Birmingham's healthcare system grows heavier and more unsustainable with each rural facility that shuts its doors. UAB Hospital operates at near maximum capacity virtually every day, while rural patients flood its emergency departments from counties that no longer have any local care options. Ambulances arrive from communities 100 miles away because there is simply nowhere closer to take critically ill patients. The facility was designed and staffed to serve Birmingham and its immediate suburbs. Now it effectively serves half the state of Alabama. The staffing levels have not kept pace with the demand. The math does not work, and something will eventually give. Staff shortages at Birmingham hospitals mean longer waits for everyone seeking care. Longer waits mean sicker patients by the time they finally see a doctor. Sicker patients mean preventable deaths that never should have happened. The chain of causation is clear to anyone willing to examine the data honestly. Nurses work double shifts regularly, just to keep departments operational. Doctors burn out and leave medicine entirely, or relocate to states that did not let their healthcare systems collapse. Those dedicated professionals who stay behind carry an impossible load that breaks some of them. Alabama's political leadership rejected Medicaid expansion repeatedly, while hospitals across the state drowned in uncompensated care costs. The decision was ideological and aimed at opposing federal healthcare policy. The consequences were brutally practical for hospitals trying to keep their doors open. Hospitals that served poor patients could not survive without adequate funding. They closed one after another. The poor patients did not disappear just because their hospitals did. They just traveled further for care or went without entirely and suffered the predictable consequences. For anyone with family living in Alabama, the betrayal by state leadership is measurable in lives lost every single year. Grandparents who waited too long for ambulances that had to drive from Birmingham. Parents who delayed seeking care because the nearest hospital was impossibly far away. Children who grew up without access to the specialists they desperately needed. The mortality statistics tell a damning story, but the human cost cannot be fully captured in numbers alone. Birmingham carries the weight of a state that abandoned its most vulnerable citizens. The city bends under that crushing weight. How long before it breaks entirely? Number 3 takes us to Gary, a city that was already on life support before the hospital crisis accelerated. Now its healthcare system is flatlining while the rest of America looks away. The story of Gary is the story of industrial America's abandonment, written in abandoned buildings and empty streets. Steel mills that once employed tens of thousands closed decades ago. Good jobs vanished seemingly overnight. Population plummeted from over 170,000 to under 70,000. And now the hospitals are leaving too, just like everything else. Methodist hospitals. Northlake campus closed its doors, leaving a city of 70,000 people with rapidly dwindling healthcare options. Ambulances dispatched in Gary now bypass the city entirely. They race past empty medical buildings toward hospitals in Chicago suburbs 25 or 30 miles away. The city that once manufactured the steel that built American skyscrapers cannot even keep a functioning emergency room open within its borders. The symbolism is devastating, but the human cost is even worse. Empty medical buildings now line the streets of Gary alongside the shuttered factories and abandoned storefronts. Windows are boarded up with plywood. Parking lots that once held the cars of patients and visitors grow weeds through cracked asphalt. The physical infrastructure of healthcare crumbles alongside the social and economic infrastructure of the city itself. Pharmacies that once filled prescriptions have closed. Clinics that provided primary care have shuttered. The healthcare desert expands its borders block by block consuming everything in its path. Property values in Gary continue to collapse as services disappear, and the remaining population shrinks. Who wants to buy a home in a city where the nearest hospital requires a 40-minute drive under the best traffic conditions? The remaining residents are often too poor or too elderly to relocate. They are trapped in a cycle of declining services and declining population that feeds on itself. Each family that leaves makes life harder for those who stay behind. Fewer residents means less tax revenue. Less revenue means even fewer services. The death spiral accelerates, and no one in power seems willing or able to stop it. Gary represents what happens when a city is systematically abandoned by industry first, then by government, and now finally by medicine itself. The pattern is visible from any street corner. Empty storefronts with faded signs, vacant lots where houses once stood, shuttered hospitals where lives were once saved. For anyone still holding real estate in Gary, the losses extend far beyond the declining dollar value of their property. They extend to the fundamental promise of living in a functioning American society. Gary shows exactly what it looks like when that promise breaks completely. Why do you think state leaders keep rejecting federal funding that could keep hospitals open and serving communities? Do they actually protect citizens, or just their own political careers and ideological positions? Let me know what you think in the comments below. At number 2, Shreveport exposes just how fragile Louisiana's healthcare system has become. The state was struggling badly before the pandemic struck. Now it is visibly breaking apart at the seams. Shreveport serves as a warning of how bad things have become and how much worse they could still get for millions of residents across the Gulf South region. Willis-Knighton and Ochsner Health Systems now dominate the Shreveport market after smaller competitors closed or were absorbed. This consolidation has created near-monopoly conditions in many areas. Prices climb because patients have nowhere else to go. Options shrink as facilities rationalize their service offerings. Patients suffer the consequences of reduced competition through higher bills and longer waits. Rural parishes that once sent patients to Shreveport for specialized care now have no local healthcare options at all. Their residents must travel to the city for even basic medical needs. Nurses are fleeing Louisiana for travel contracts in other states, where pay is dramatically higher. The salary differential has become too large for many to ignore when they have families to support. A registered nurse working full-time in Shreveport might earn $60,000 annually. That same nurse with identical qualifications earns $120,000 or more working travel contracts in California or New York. The math is simple, and the decision is rational. But the consequences for Shreveport are devastating. Experienced staff leave and take their institutional knowledge with them. New hires lack the mentorship they need to develop clinical judgment. Patient care suffers measurably as a result. The city that once promised oil money, wealth, and southern opportunity now struggles to adequately staff its own emergency rooms. Oil and gas prices fluctuate wildly with global markets and geopolitics. Healthcare costs only climb higher each year, regardless of economic conditions. The residents caught between these opposing forces find their options narrowing year by year. Insurance premiums rise faster than wages. Hospital bills compound into crushing debt. Retirement savings evaporate, paying for care that should be affordable. The promise of prosperity has become a bitter joke for many families. For retirees who settled in Shreveport expecting stability and affordable southern living, the reality is a healthcare desert disguised as a welcoming community. The famous southern hospitality cannot compensate for vanishing medical services. The affordable cost of living means nothing if quality healthcare is unavailable or inaccessible when you need it most. Shreveport offers a cautionary tale for anyone considering retirement in similar communities across the South. The next chapter in that tale is being written right now by healthcare administrators making difficult decisions. And based on current trends, the ending does not look promising for patients. Number 1 on our list is Flint, Michigan. This city was poisoned by its own water supply, when government officials knowingly allowed lead to contaminate drinking water. Now its hospitals are dying too. Flint represents the ultimate and most complete failure of every system that was supposedly designed to protect American citizens from harm. McLaren Flint, the city's last major medical center, announced it would close its inpatient services. 160,000 residents will soon be left without local inpatient hospital care of any kind. The nearest hospital capable of admitting patients will be approximately 20 miles away. For a city with one of the highest poverty rates in America, that distance might as well be 1,000 miles. Most Flint residents cannot simply drive 20 miles whenever they face a medical emergency. The announcement was another betrayal in a long series of betrayals. The lead water crisis that began in 2014 created an entire generation of children who require ongoing specialized medical care. Lead poisoning causes developmental delays that persist throughout life. It causes learning disabilities that require special educational services. It causes physical health complications affecting multiple organ systems. These poisoned children required and still require ongoing treatment from specialists who understand their unique needs. They required pediatric neurologists and developmental specialists and occupational therapists. Now their healthcare lifeline is being severed just as they enter adolescence. The government at every level promised to fix what happened in Flint. Instead, it abandoned the city again. Transportation is desperately scarce in Flint. Poverty is endemic, and many residents do not own reliable vehicles. Public transit options are extremely limited and do not connect well to healthcare facilities outside city limits. A 20-mile trip to a hospital in a neighboring community becomes an impossible journey for residents without cars. Some will simply not make the trip and will go without needed care. Others will delay seeking treatment until their conditions become critical emergencies. The preventable deaths from this healthcare desert will accumulate quietly over years. Nobody will count them accurately. Nobody in power will be held accountable for them. Flint shows exactly what systemic betrayal looks like in 21st century America. First came the water crisis when officials poisoned an entire city to save money. Then came the economic abandonment, as General Motors and other employers left. Now comes the healthcare collapse, as the last major hospital prepares to close its inpatient services. Each failure compounds and amplifies the previous failures. The children who were poisoned by lead will face health consequences for the rest of their lives spanning decades. Those consequences will require specialized medical care that no longer exists in their own city. This is not some distant abstract tragedy. It is happening right now to real families. And if it can happen in Flint, it can happen in any American city. The lesson of Flint extends far beyond one struggling city in Michigan. It reveals what happens when profit consistently takes priority over people. It shows what happens when political convenience trumps public health and safety. It demonstrates what happens when promises are made to vulnerable communities and then broken without any consequences for those who broke them. Every city on this list shares elements of that disturbing story. Flint simply makes the pattern undeniable and impossible to ignore. The question now is whether anyone with power will finally pay attention before more cities follow the same path. Your health is your most valuable asset, and that asset is under threat in more places than most people realize. The hospitals you assumed would always be there are closing their doors. The safety nets you trusted your entire life are unraveling faster than they can be repaired. The politicians who should be protecting their constituents are often looking the other way, or actively making decisions that accelerate the crisis. Knowledge is your first and best defense against being caught unprepared. Understanding where healthcare is collapsing helps you plan for your future and your family's future. It helps you protect the people you love from making dangerous assumptions. It helps you make major life decisions based on reality rather than marketing materials designed to attract your retirement savings. Subscribe now, and if you are watching on TV, tap your remote so you never get blindsided again by the real dangers hiding in plain sight.